Thank you for being here today. My name is Andrea Peluso. I'm the Executive Director of Family Forward Oregon and the co-chair of the Fair Shot for All Coalition. We're here today because Memorial Day typically marks the beginning of the end of the legislative session, and our lawmakers have yet to act on key policies that will help hardworking Oregonians have a fair shot, such as paid sick days and a path to retirement security. Many of our elected representatives, some of whom are here today, know that working families have waited long enough. And they're standing here together with us today to ensure that we move forward on some key policies that will help working families. We're also joined by some workers and some business owners who support paid sick days and other key policies that help give families a fair shot. For the Oregonian who has worked his entire career without a paid sick day, change cannot come fast enough. For the single mom who gets up at 4:30, takes 2 buses to work, skips meals she can't afford, gets home well after the kids are asleep, and still comes up short at the end of the month, change can't come fast enough. I want to be clear that until there is a strong paid sick days bill on the governor's desk, we'll be working around the clock to make sure all Oregon workers have the dignity and respect in the workplace that they deserve. I'd like to welcome Senator Sarah Gelser.
Thank you. Good afternoon. My name is Sarah Gelser. I am the state senator from Corvallis and Albany. One thing that is true about all of us, wherever we live in this state, every single one of us gets sick. Unfortunately, not all of us have the economic ability to have time to recover. More than 2/3 of Oregonians working in low-wage jobs don't have even one paid sick day off. These workers are disproportionately women and people of color. And no one should be forced to work when they or their kids have the cold or the flu or even worse. I know how important this issue is to Oregonians because last year I campaigned in Corvallis and Albany, 2 very, very different communities. Together we knocked on over 100,000 doors, and what I heard over and over again is that workers need to be able to take time off when they're sick, and they need to not give up their income to buy groceries and pay rent in order to do that. I promised the people who elected me that if they sent me to Salem, I would work to make sure that we passed a strong statewide paid sick leave policy. And I'm here today to keep fighting for that and to keep the promise that I made to the people in my legislative district. Expanding paid sick days has been in the headlines recently, both here in Oregon and across the country. 3 different states and 16 cities have now passed laws and approved measures allowing workers to accrue and access paid sick days. Over the past couple of years, my colleagues and I have heard from many, many Oregonians calling on us to build on the progress made with local ordinances in Portland and Eugene and enact a strong statewide paid sick days law. Every Oregonian deserves that same basic right. There is no reason why we can't accomplish this in Oregon. We must accomplish this before we go home at the end of session. Now is the time to take action and expand paid sick days to every single community in the state of Oregon. Our workers deserve no less. Thank you.
Hi, I'm Senator Michael Dembro from Northeast and Southeast Portland, and I chair the Senate Workforce Committee. We've been working on this bill for this entire session, and actually there was a stakeholder work group that had been working on it for many months before the session. And over the course of that time, we had many, many meetings with industry, with advocates, with people who would be potentially affected by a change in the state's policy towards sick leave. And we have emerged with, right now, Senate Bill 454, which is a good bill. It took, as I said, it took many, many hours of work. I can't tell you how many hours of sleep I myself had to do without, but it's all been worth it. And I think what we have now is a bill that works, and it's a bill that needs to be passed. During, during one very long hearing that we had on the subject of sick leave back in February, we heard from Janice Nyang, a school bus driver in Gresham, who does not have paid sick time at her job. And in December, Janice had to go through an illness, and she couldn't take the time off, and the illness got worse and worse, and finally she was forced to head straight to the emergency room. Missing work to receive treatment at the hospital severely cut into her paycheck because she was put into that impossible position of having to choose between caring for herself and keeping her job and maintaining her livelihood. There are workers like Janice all over Oregon who currently have no choice but to go to work sick or risk losing their jobs by seeing a doctor or staying at home to recover. Or doing the same for a child who needs her or his care. Just a few paid sick days a year will give us all time to recover and help keep our workers, our families, and our communities healthy. Senate Bill 454 will do that. And again, that is why it's so important that this session must see the passage of this bill. Thank you.
Good afternoon. State Representative Paul Holvey, House District 8, which is out of the Eugene, South Central Lane County. And I chair the House Business and Labor Committee, the counterpart to Senator Dembro's committee, where we did work closely together in terms of crafting legislation that's in Senate Bill 454, and also we have a companion bill, House Bill 2005. I just wanted to talk a few minutes about, just to follow up with Senator Dembro's comments about how much work we put into this. It is a long process. I mean, we did listen to over 300 individuals in public hearing and listened to a lot of concerns from businesses, a lot of concerns from workers. And trying to balance that, we did form the work group that he referred to further hone down some of the big issues that we're facing, the businesses, facing governments for trying to implement this, and really the concerns of workers that also really need some paid sick time when they need to stay home to take care of themselves or their children. It is a big public policy that we really think is important, that we shouldn't be forcing people because they can't afford to stay home to go to work that puts the public somewhat at risk if they're working in the food service industry, child care, taking care of seniors, just a lot of places where people shouldn't go to work sick. And so through this process, I think we have come up with some good proposals, a good solid bill that deserves consideration on its merits. And so it is a little frustrating that we're at this point in session, haven't quite got there yet. I'm optimistic we're going to get there. I know a lot of people have concerns with other issues around this that they keep trying to solve within this paid sick time bill, but I really think we need to focus on paid sick time and do something about it. The concerns of not doing anything about it, of course, are frustrating to many as well. If we end up having, different standards throughout the state, some are troubled by that as well. So we have had all these discussions. I just encourage everybody to keep their thoughts about paid sick time to paid sick time, and let's see if we can get this thing done this session in the next couple of weeks. Thank you.
Good afternoon. I'm State Senator Elizabeth Steiner Hayward, and in addition, I'm a family physician, which is one of the many reasons that paid sick time is so important to me. I had the privilege, along with Representative Vega Peterson, of chairing the work group that you've heard about in the interim between the 2013 session and now, and it was a very inclusive process. We had representatives from industry, from small business, from all sorts of workers groups, from the grocers, from everybody who might be affected by this bill, come together and craft legislation that addressed as many concerns on all sides of the issue as possible. Additionally, Senator Dembro and Representative Vega Peterson and I met with a large group of business people from Portland in January to talk about their experiences with Portland's ordinances and made adjustments in the legislation that's now before you in Senate Bill 454 to address concerns that had come up, glitches, things weren't weren't working smoothly. As a physician, I really feel strongly that this kind of public policy is very important for the health and well-being of our state. We've seen these epidemics of influenza. This year we didn't cover the flu vaccine quite right. People come to work sick, and all of a sudden half your workforce is out. And we know that as a public health measure, this is critically important. Furthermore, we made a promise. We made a promise that if the people of Oregon elected strong majorities in both chambers, that we would help move forward on sick leave. You've heard that from my colleague, Senator Gelser. It was certainly something that I talked about, and many of my colleagues did. We owe Oregonians this policy, and we hope to deliver on it with a strong bill that will enable people to take the time they need to get treatment early, like the woman that Senator Dembro mentioned. I know as a physician that if you treat certain illnesses quickly, you treat them fast, they get back to work fast, it's less expensive, it's less time off work. But if people have to wait until they're critically ill and end up in the emergency department, then the whole thing spirals in the direction that none of us wants it to go. An ounce of prevention is worth a pound of cure, and this kind of policy will be the ounce of prevention that we need to keep Oregonians healthy and productive in the workplace. Thank you.
My name is Melody Gramley, and I've worked in the grocery store here in Salem for about 19 years. But when I'm sick, I have to make a choice between staying home and getting better or coming to work. It doesn't matter if I'm coughing, sneezing, or have a fever. If I'm not at work, I'm not getting paid. The same goes for some of my coworkers. They're coming to work sick, whether they're working at a cash register or if they're handling food. It's not good for our customers, and it's not good for our other coworkers. I also have a grandson that has a lot of medical issues. He's only 5 years old, and he's already had several major surgeries. When he's in the hospital, his mom has to stay with him to take care of him, which leaves her not being able to attend work as well. I try to be there as much as I can to help out with my grandchildren, but also I can't afford to take the time off work. It shouldn't be a luxury to have a day to recover from the flu or to take care of our children. We need our legislators to take action for working Oregonians, and we need them to do it now.
Hello, my name is Joe Gallegos. I'm the House Representative for House District 30, which is Hillsborough, North Plains, a little bit of Aloha, and Beaverton. I just wanted to step up and acknowledge that during my knocking on doors, this was constantly coming up as an issue in terms of really helping working families in Oregon. And so it was a promise, a campaign promise, to make sure that we gave those families a fair shot, and that's what I'm here to continue working on. And it isn't really a hope that we address this. I don't intend to leave Salem until we do address this. Thank you very much.
Hello, I'm Peter Emerson. I own the Bipartisan Cafe in Portland. And the first thing I'd like to say is that I have been living with paid sick pay for a year now, almost a year and a half, and the doors are still open, payroll is still getting met, business is still good. I admit that when I saw it coming, I had concerns about how I was going to pay for this additional expense, but what I couldn't see when I was thinking about that was the benefits that I got. And the benefits that I have are an employee has the opportunity to take one day off instead of working sick for 5 days, serving food, working in close encounters with my other employees, in which case it spreads through the whole cafe and probably to some of my customers. It wasn't that long ago where I was in the same boat as my employees, and I have 2 kids who are paid employees, and all of my plenty of my customers are paid employees. So the benefits to the morale in my cafe and also them not losing that economic, taking that economic hit means that my customers, my employees can actually afford to buy a cup of coffee in my cafe. Thank you.
We wanted to take a minute to answer questions that you might have.
Representative Holvey, you mentioned other concerns that were kind of being inserted into the debate over this bill. Can you elaborate on that a bit more? At the microphone, please. Thank you.
Well, I think, you know, the concerns I'm talking about are, you know, the concerns about whether individual local governments should have control of these policies or whether they should be statewide decisions. And so there's been a lot of conversation on both sides of that issue about whether we should be preempting local government or whether there should be a statewide policy. So that's one of the big issues that's been out there. I think we've got a good draft in 454 going forward, and you know, I'm hoping that people can get around that.
Expanding on that just briefly, I know there's been some discussion about bringing in the minimum wage piece and having a deal, and my understanding is proponents are also in favor of doing both. Is your statement today that you want sick leave considered on its own, a willingness to drop some of the other discussions around minimum wage and local laws there as well?
Well, I think it's fair to say that there's plenty of discussion on both sides. We always end up talking about a lot of different things. The minimum wage discussion, I think, is a separate discussion, but it does come in the context of this bill as an employment right, so it's perfectly fine to bring it up. I just hope that we can come to an agreement on sick leave, where I think we've had a lot of due process. The minimum wage discussion, I think there's still a lot of differing opinions there. I'm not saying it can't be done. Time will tell. We might be able to get there, but I feel real comfortable that we've had a really good, robust discussion about paid sick leave, and I'm very positive about getting that done.
What seems to be the main holdup getting it onto one of the floors and out of Ways and Means?
Somebody else want to talk about that? Maybe I'll let the senator talk about that.
I think, one of the holdups was just alluded to by Representative Holvey, and that is the question of whether sick leave should be on its own or should it be packaged with something else, either some larger preemption. It's kind of ironic that this bill does have a preemption on sick leave. That is, this policy that we're coming up with is a statewide policy, and it will remain a policy that's consistent across the state in every respect, except there's a slight difference for the number of employees who are included. Those of you who have followed the bill know that the standard in 454 is 10. An employer that has 10 employees will provide paid sick leave for its employees, and whereas in Portland is grandfathered at its current level of 6. But aside from that, everything else is consistent and statewide. Some people liked that consistency and, sort of kind of went whole hog on it and said that, well, we need to preempt everything related to employment practices. We like what you're doing so much in sick leave that we want it to apply to everything, which, is, controversial and is just simply not going to happen. And the other issue is, as Representative Holvey alluded to, does this get packaged up somehow with the minimum wage discussion? And, at this point, I can't say whether it will or not, but if it does, the bill that we're talking about, the sick leave bill, 454 and its provisions, will be part of that larger package.
And I can say that for our coalition, the Fair Shop for All coalition, we absolutely encourage folks in this building to be having robust conversations about the minimum wage. We'd like to see it have the same degree of stakeholder input that we've put into paid sick leave. Any other questions?
I was wondering if, Melody, could you spell your name for us?
Melody.
And last name?
Gramley.
Thank you.
Those questions that Senator Dembrow raised, who's the arbiter of that? I mean, who's going to, you raise the questions, who's going to make the call on which side this lands on?
The Constitution says we have to have a majority of the legislature. And so, as in all things we do, the Constitution is the arbiter.
All right, any final questions?
Senator Dembrow, in terms of trade-offs, do you consider, or priorities, is paid sick leave a higher priority than minimum wage, or vice versa? If you had to get one done this session.
I would say sick leave. And, you know, I say that because, you know, as was mentioned, there has been so much work has gone into it. This is a program that's ready to go. Minimum wage, you know, I think many people are supportive of raising the minimum wage. But the question of what is the exact number that's the right number for that, and whether we want to accompany that with a lifting of the preemption on minimum wage. Right now we have a statewide preemption so that local governments cannot enact a higher minimum wage. That all, you know, still really needs to be discussed and debated. And Representative Holvey and I have committed to having a bicameral work group to really focus on that, to come up with what is the right number. As you know, there is a proposal out there. So signatures are going to be collected on an initiative that could take this question out of our hands. But we feel that the legislature should have its own proposal in place, and I think we really want to work on that in advance of the February session.
This is a question maybe more for Andrea, but about that ballot initiative. My understanding is part of the negotiations, one of the things that's on the table is holding off on that perhaps for some years if we can get a package of some kind through the legislature. Is that something you're willing to do, some kind of deal on that front?
I think, you know, our priority remains having a process work through the legislature, and it's unclear to me whether we'll be able to accomplish that in the near term.
Would you be willing to put that on the table as a discussion point if you could get something through the process?
It's not up to me, so I would say it's something that a larger group of folks would need to discuss. Yeah. All right, well, thank you very much for joining us today. Many of us can stick around to answer additional questions if needed, and please feel free to get in touch with any of us individually too. Thank you.